First responder needs assessment, as written up here by the APA in this article. Protective factors include perceived optimism, self-support, family relationships, spirituality or religiousness, and interpersonal orientation. So those are things, obviously, that are protective factors for all of us. Disaster response competencies covers behaviors of preparedness for disaster work. So preparedness behaviors include collaboration with one's team, stakeholders, and community helpers, particularly true with police. Flexibility and openness and their own thought and introspection. Resilience in a strength-based perspective. Psychosocial interventions. So, sometimes other stresses in their life may just tip the scales and kind of put a chink in that armor the emotional armor that they go into each shift with. Listening to stories of loss and grief, having an understanding of that. Understanding a community's culture, again, very particularly important with police. Culturally informed responses, and being prepared to address ethical challenges, what those ethics are, and how to respond to them. Obviously something that is hopefully part of all of our social work training as well. Okay. Along the continuum here of the factors in the needs assessment as proposed by the APA, resilience covers social competence in unfamiliar context, seeking community resources for one's own toolkit, self-efficacy in disaster work, as well as a sense of purpose and achievement. Achievement can be hard to come by because you can have a run of responses that where you go into situations and it's really kind of more recovery and containment. That rescue is just not going to be part of it, and helping them be prepared for that. Obviously, self-care, emotional, social, physical, intellectual, relational, safety and security self-care, self-compassion, and some of this is we've already talked about, right? In this context, referred to close awareness and acceptance of one's sufferings and situations that might bring pervasive feelings of personal inadequacies, failures, or mistakes. Trying to help first responders have an open mind to, dude, you work a hard job and you see a lot of heavy shit, and can you offer yourself some compassion and, hey, that's going to get to you. There's no way it can't. You're not a robot. As much as you want to be a superhero or a machine, you're just not a human being. And we all have thresholds of those, how much of those PTEs we can take before it really affects us. So risk factors include environmental stressors, socioeconomic low socioeconomic status of responders. Obviously, most civilian first responders are not, very, maybe barely, many of them have socioeconomic stress. I can tell you, firefighters and paramedics I work with as an example, almost all of them have second jobs, doing other stuff to supplement their income. So as an example, okay. Vicarious traumatization is, for us as well, right? That there is just, we intake a lot of trauma. I think the difference between us and maybe firefighters or paramedics is it's a lot of times we're hearing, we're dealing with more in the aftermath, and they're dealing with it as it's happening. So, all right, so working with this model, the authors propose what they believe would be the best treatment options for preventing PTSD after a traumatic first responder event. So in other words, maybe responding to a school bus accident, for example, loss of life of children. Just as an example, or some kind of mass shooting incident, or some some of the size of the automobile accidents where there's massive, massive carnage and loss of life. So these are kind of this is kind of like the little checklist they made of the modalities that they found to be, through the research that they did for this article, most useful. So critical incident stress management, CBT, cognitive processing therapy, brief eclectic psychotherapy. I'm not exactly sure what they mean by that, but you can put brief psychotherapy there. I think that'll, and rapid eye movement desensitization treatment, which I'm not trained in that myself, but I have heard anecdotally, as well as read literature, but even directly and anecdotally, I've heard of success with that treatment. Authors conclude that the protection of mental health includes systemic change to increase access to resources that will better serve the mental health needs of first responders. Providers need to be aware that first responders' personal social characteristics, such as commitment to help in crisis, external pressures on their service, and the importance of social support in their mental health. These are key things that are particularly nuanced to working with first responders. And I've gone to a few CEU things, but most of my first responder work, I've kind of had to, like most things, learn on the job. So I definitely would like to see more formal training available to, either within a program like ours or as continuing education services. So doesn't seem to be a whole lot of that offered. So finally, some last data points here from the article. Policies need to be in place that address the unique needs of different subgroups of responders, so firefighters, police, EMTs, volunteer, clergy. They're kind of like the branches of the military. They, just from an analogy standpoint, they definitely all have their distinct cultures and be very particular of such. So so understanding, in other words, you wouldn't mistakenly refer to a firefighter as police or vice versa any more than you would mistakenly refer to an Army person as a Navy person. That's often a big deal to those individuals. Okay. Need for continued research on effectiveness of interventions and development of proactive prevention and reactive treatment interventions. Both proactive to account for the number and frequency of potential traumatic events and the higher risk of experiencing PTSD or PTSD symptoms, PTSD type symptoms from those exposures. Social justice is often overlooked in individual and group psychological work and has important implications for practice with underserved populations. And if you think of, thinking of any particular group that's not getting the, has a greater need for services than they have reasonable access to, I think is how they're defining underserved populations there. And finally, there needs to be increased access and institutional support prior to and after traumatic events. From the top of leadership, and we see a little bit of that from the IAFF leadership and both current and retired senior firefighter leaders.